Okay, this video is going to cover the male reproductive system. Again, the model and the camera make it a little bit difficult to do this, but bear with me. We're going to start down here. This structure on the outside is the scrotum. The scrotum is homologous to the labia majora of a female. So both are covered in hair and both essentially protect the reproductive organs internally. In this case, the scrotum is protecting the testes or singular testis. Now it's hard to see from this angle of the camera, but there is a little ridge between the two halves of the scrotum, and that ridge is known as the raphe. Let's take a look inside of a testis real quick. We have little tubes inside of our testis known as seminiferous tubules. It's in the seminiferous tubules that we're going to start to see spermatogenesis occur. From the seminiferous tubules, our sperm are going to travel through some other ducts, but eventually make their way out here to the epididymis. The epididymis is where spermiogenesis occurs, which is the growing of tails for the sperm, which interestingly they won't use until they actually leave the male reproductive system. Now, moving from the testes and the epididymis, we have to find a way to get the sperm into the pelvic cavity and then back out the penis. And in order to do that, the sperm are going to travel up this structure here known as the vas deferens or ductus deferens. This is what they're cutting when you get a vasectomy. Joining the ductus deferens or vas deferens is the testicular artery and this blue structure known as the pampiniform plexus. The pampiniform plexus came from the testicular vein, which is located up here. So it's hard to see, but you have the testicular vein and the testicular artery, these smaller ones here, intertwining on their way down. Now, the pampiniform plexus, the testicular artery, the vas deferens, as well as some nervous tissue are all collected in a structure known as the spermatic cord. Now, as the vas deferens heads into the pelvic cavity, it's going to dive behind the bladder of the male. And as it does that, it's going to enlarge slightly here at the ampulla and join a duct coming from a gland known as the seminal vesicle. The seminal vesicle is a gland that helps to keep sperm healthy. It's going to secrete fructose for food, prostaglandins to dilate the cervix, and bicarbonate to neutralize the acidity of the vagina. It's a viscous kind of whitish yellow alkaline fluid. So the seminal vesicle and the ampulla are going to meet at the ejaculatory duct here, which is located inside of the prostate, which you can also identify out here. The prostate contains citric acid, which is additional nutrients for the sperm, seminal plasmin, which helps to rid any bacteria that may build up in the urethra, and PSA, which is an enzyme that helps to liquefy the fluid of the semen. That way the sperm can move whenever they get out of the body. Now, from the ejaculatory duct, the semen now, which is our sperm and our fluids, will enter the prostatic urethra. From the prostatic urethra, we'll enter the membranous urethra, and we'll also see some lubrication from a gland here called the bulbourethral gland. The bulbourethral gland helps to lubricate the rest of the urethra prior to ejaculation. So from that membranous urethra, we travel through the spongy or the penile urethra out the penis. The reason why this is called the spongy urethra is it's because it's surrounded by this erectile tissue known as the corpus spongiosum. The corpus spongiosum has two other erectile tissues that sit on top of it, and those are known as the corpora cavernosa, which are plural for corpus cavernosum. These erectile tissues have pockets for blood, which fill during an erection. Interestingly, erections are controlled by the parasympathetic nervous system, which is rest and digest, which is occasionally why males, when they wake up, they sometimes have an erection. So to reiterate, there is no bone in the penis. It's just a space that fills with blood that causes an erection. Now, on the outside of the penis, you have the possibility of having a prepuce or foreskin. So that is this extra tissue here that surrounds the glands of the penis. So this model shows a circumcised penis, and then on the other side, there's this skin that's called the prepuce that covers the distal end of the penis called the glans, which we also saw in the female, both the prepuce and the glans. So when we look at a penis, it does have 3 different regions to it. It has the glans, which is the most distal part, the body, and then the part that's embedded in the pelvic floor is known as the root.